Right. Today we're going to be talking about how we would assess hip flexor contractures via the Thomas test and the rectus femoris, also known as the Kendall test. We're going to ask the patient to come towards the edge of the table and sit down for me, and ask them to bring their untested leg, knee to their chest. And we're going to help by placing our hand behind their back and transition them into supine. Now we can assess for excessive lordosis by trying to slide our hand underneath their lumbar spine. And if there is a gap, then we ask the patient to bring their knee closer towards their chest. Now we're going to observe the thigh, the angle of the hip, and if the thigh rises from the table, that would indicate a hip flexor contracture, typically due to the rectus femoris muscle. If it abducts instead, that's the J sign or the stroke sign, which would indicate a tight IT band. That concludes our Thomas test. And in order to do our rectus femoris test, which is very similar to the Thomas test, all you have to do is bring their knee towards flexion of 90 degrees, and while palpating for the rectus femoris, if you notice that the leg elevates and notice that there's tautness with the rectus femoris, then that tightness would be due to the rectus femoris. If there is elevation without taut muscles, that would indicate a tightness due to joint capsule.